T-Bone and Heather on Star 98.3 and 97.7 The Bay.
8:31. Good morning, everybody. Welcome to the show, and join us on the phone lines this morning is Dr. Dabulis. Good morning, doctor. How are you?
Good. Happy Monday.
Yay!
Happy Monday to you.
Yay.
There you are. So glad to have you on the air, Stephanie, again. You are over there.
Stephanie, like you're on a first name basis.
It's cool. I'm good.
I have a friend who's a doctor. Hey, Dr. Dabulis, you are over there at Calvert Memorial. You're there with Calvert Health emergency rooms. Can we talk about emergency room medicine a little bit and maybe the issues that you had with COVID? Are you still seeing those issues in the emergency room with COVID patients? Just an influx?
Sure. That's a great question. I think we talked last in September, and at that time we were starting to see the Delta variant. And then by January 11th, we actually peaked. We had seen 35% positivity rate. So yes, the ER was moving and shaking. We were low on tests. We were having commodity of space. And in terms of hospitalizations, 40% of our inpatients were actually COVID positive. Now, fast forward to March and April, and we actually didn't have more than one or two COVID positive patients hospitalized a day. And as of today, we have zero COVID positive patients.
That is awesome.
That's awesome news. That's fantastic.
That is
Okay, and I know you
Little breathing room for you guys, right?
Yes.
and you deserve it. Yeah, the nurses
you.
and doctors all deserve it. Now, let me ask you this about emergency health, because I hear some people talk about it like they know. But let me ask you, since
Like me.
you're the chair there of emergency health. Do people go to the emergency room for everything? I mean, is it from tick bites to a sniffle? I mean, when should somebody truly consider the emergency room, and when should they go, okay, maybe the emergency room is not for me?
Well, the day that people come to the emergency department is a bad day for them, right? And everybody, it's a spectrum, what people can tolerate, what they're concerned about. A lot of my job is actually reassurance.
Mm-hmm.
So I think that's a tough question because, sometimes chest pain is just indigestion and heartburn, but sometimes it's a heart attack.
Mm-hmm.
And it is really hard for people to know. And I don't blame anybody for coming to the emergency department if they're concerned about something. And I think, that's where we have to have a little bit of grace and a little bit of kindness. And I think that, the day I can reassure somebody about a tick bite, it's not just a tick bite. It's that they know somebody who has Lyme disease and they don't want to get it.
Gotcha.
But do you blame the internet?
Dr. Google is actually my enemy.
Yeah, I know.
Every day I go to work proving Dr. Google's wrong.
My doctor has told me, seriously, like 150 times.
Stay off of web
Stay
and
the hell off the internet. You don't have Legionnaire's disease.
That's wow. Yeah. So I can tell you that you have been researching.
Yes, I have.
He does, Stephanie. He does all the time. So what do you find are the biggest challenges right now with emergency health? Not just at Calvert Medical, but maybe region-wide or statewide.
Sure.
What are the biggest challenges you guys have?
Well, I think what we're seeing now is still, reflection of the fact that for 2 years, it was really hard to go see your doctor. I mean,
Yeah.
I just actually saw my primary care doctor at Calvert Health a week ago, and honestly, I'm just as guilty. I hadn't been there for 2 years. So I think we're seeing a lot of heart attacks now. We're seeing a lot of strokes again, a lot of diabetes complications. And I think that it's time to get back to your doctor in person. Telehealth was a great solution during the pandemic, but right now your doctor wants to see you in 3 dimensions. I mean, I think that it's really important for them to listen to your heart, lungs, get back on those medications. And I think we're seeing people who haven't gotten cancer screenings done. We're diagnosing a lot of cancer in the emergency department. We're seeing a lot of substance abuse again.
Wow.
And people are sad. So reach out to your doctor. see them in person, let them do a wellness check on you, let them examine you and see what you need again. We're at that stage.
Dr. Dabulis, is it because it's been 2 years of craziness? You said we're seeing more strokes, more heart attacks, sadness, depression. Is it because of the 2 years where we just hunkered down and held our breath?
That's a tough question, right? I mean, I think we had to do that, honestly. But yeah, I think there are some ramifications of it. I think the news, we didn't go after, declaring victory to COVID to something good on the news. Trust me, with Ukraine. I think
right.
That,
I know, right.
People are, it's a time to reach out, be together with people. I think that we are seeing some reflection of that.
Okay, so the last doctor we had on from Calvert Medical corrected me, and I'm not going to pit doctor against doctor, but there is no vitamin D in the sun. You have to have vitamin D in your body first. Is that correct, for the sun to activate it?
Yes.
Okay. See, I was wrong. I thought you could just go out and get a suntan and then everything you were good with vitamin D. And she's like, no, that's not how it works.
I'm on vitamin D. It's a great medication, and I love the sun. So I think both are compatible. So you're not pitting doctor against doctor, but I would take your vitamin D.
Why are we all vitamin D deficient? I mean, everybody I talk to, Stephanie, is vitamin D deficient. What is that about?
I mean, for me, I think I can definitely improve upon my diet. I always joke that emergency medicine doctors should not ever lecture anybody on nutrition. I mean, I like my saltines and my sodas.
Good girl.
And so,
yeah.
The typical turkey sandwich that's in the emergency department. But I think that, again, with this being Public Health Week, we all can do better at getting more vitamin D in our diet. We can exercise, and I think that this year, I think, is going to be the year where we all just become better versions of ourselves.
I like that. Better versions of ourselves.
Let me circle back to something you said when you said you went to see your doctor. So there you are at the doctor's office. Do you critique the doctor when he or she when you finish up, do you go, you call that a physical?
No. I have an amazing doctor at Calvert Health, and she's wonderful. But no, I don't criticize my colleagues. I start off with, Dr. Google said that.
Yeah, right.
Is it ever Dr. Heal Thyself? Do you diagnose yourself and go, I better go get a second opinion?
Yes, because I think that, especially emergency medicine, we are the worst case scenario people. So we will have ourselves diagnosed with something terribly awful. And then also we need reassurance too.
Yeah, I get you.
Stephanie, stay off the internet.
That's right.
That's what you need to do.
That's right.
That's good advice. Sage advice, definitely.
Listen, I am thrilled, relieved to hear that. Not that things are slowing down for you. I don't think they ever slow down at the emergency room, but at least you're getting a little bit of a reprieve from the whole COVID thing. And maybe that'll give you guys some breathing room. And, I'm sure you've heard it, but you can't hear it enough. Thank you so much for all the hard work
that
everybody did through that. It was just crazy.
And continue to do today, seriously.
Well, just one more thing.
Sure.
If COVID numbers go up, just remember Calvert Health we still give monoclonal antibodies. We have Evusheld, which is a great long-acting antibody combination for those who can't get the vaccine. And now there's an oral medication called Paxlovid. So just in terms of those things, public health, remember if we start seeing some increase, BA2, the new variant, just remember that Calvert Health, the emergency department, is definitely still able to take care of you. Don't stay home. Come see us. We'll get you taken care of.
Okay, before you leave, what is the scuttlebutt like in the doctor's lounge? What's the scuttlebutt about the new variant that's out there? I mean, are you guys nervous? Are you kind of like done? We're just going to treat and do as best we can? Or is there like a little dark cloud that hovers over you when you think about the new variant?
Well, I think psychologically it is better. I think that we know how to take care of it. We know how to keep ourselves safer. So that aspect is improved. I think that we know that there'll be more cases in the fall. We completely understand that. I think that, I still go to the grocery store with a mask on. I still think that, those things are important for public health. I think that we are a little worried. I mean, I think we know that we've been seeing some increasing numbers in the Northeast, and generally, we're about 2 weeks behind. So I think that hopefully the summer will be good, like it was last year. I think in the fall we're going to be seeing more numbers and seeing more numbers in the emergency department again.
Okay.
But I'm always optimistic. You know me. I'm always optimistic.
Sure.
All right.
Yeah. Well, Dr. Dabulis, thank you so much. Dr. Dabulis, she's the chair of emergency medicine at Calvert Health Medical Center right there in Prince Frederick. Thank you so much for being patient with us this morning. We can't thank you enough.
Thank you, Doctor. While we've been talking, I've Googled 4 different things that I definitely need to see
have
about.
them all.
It turns out I have them all. I have every single one of them. Yep. All right. Thanks for your time this morning. I
Thanks,
appreciate
Stephanie. Have a
Take
great
care.
week.
Bye.
All right.
There's always this fatigue. Oh yeah, I'm a little fatigued.
I'm a little fatigued, sure.
Headache. So yeah, I do have a headache.
Right, yes. Dehydration. Boy, I'm really
You know what they
thirsty.
should do? You know what they should do?
What's that?
Seriously, this would go a long ways to, I think, alleviate a lot of that. Post a picture of a guy that has it. Do you look like this guy? No. Then stop it. That would help me a lot. All right, listen, our phone lines are open for you if you want to be part of the show this morning. That's fantastic. We love to see what's going on in your world. And, shared misery is good misery, I guess, if there is such a thing. 1-800-782-7983 or 301-884-4615. Yeah, my doctor, seriously, she's like, seriously, you stop it. Just get off the internet. That's not what you need to be doing.